My name is Dr. Suresh Kumar Singhvi. I am a senior liver transplant surgeon with more than 15 years of experience in liver transplant. I have worked extensively in various countries including England, Germany, South Korea, and now practicing in India as a senior liver transplant surgeon. Hepatitis Day, it's very important for us. It is because prevention is better than cure. We have to find out the disease early, make a diagnosis, and get an appropriate treatment. Nowadays, the treatment for hepatitis B and C has progressed so well that many patients who suffer from this may not end up with drastic complications of hepatitis B and C. So we have to understand to see and prevent this disease. It's very important to all of us. It saves a lot of miseries. Hepatitis B can be prevented by appropriate vaccination and prevented by taking appropriate measures in our day-to-day life. So, prevention has become a very important step in our life. Hepatitis B and C is easily transmitted in so many places by very common measures. So, common conditions like wherein people have heard about IV drug abuse. It is common in various cities, cosmopolitan cities, but in the rural areas, the common cause of spread of hepatitis B and C is due to unhygienic conditions or due to unsterilized instruments being used, like surgical instrument during dental treatment, or even injections as well. So, it is also seen in rural areas, the hepatitis B and C is transmitted in the rural population where they normally go for regular shaving. This is a very important reason why transmission happens, because these barbers tend to use they change the blades but not the razors. So you can easily transmit the infection where the droplets of virus is present on the razors. So I sincerely advise people not to share their toothbrush, their shaving razors with anybody else. After identification of hepatitis B and C, if treated early, cirrhosis is prevented and a person can lead a normal life. It is very important that the life partner of the particular individual suffering from hepatitis B should be immunized and also be tested for hepatitis B. Hepatitis C has now in the recent days, we have got lots of wonderful medicines, and with investigations and the cost of treatment has gone down drastically, and a specialist needs to be seen before this treatment has been started. The very important stage comes when most of the people are not even aware that they have hepatitis B and C and end up with cirrhosis. So when they end up with cirrhosis, even at early cirrhosis, medicines can be given and to prevent the progression of cirrhosis, and if needed, the liver transplantation can be postponed at least by a few years. And when it need be, a liver transplantation is necessary, then the patient has to see an appropriate surgeon at the correct moment to undergo liver transplantation. We wish nobody ends up at this stage, but it's important that we prevent this disease. And if there is a disease that is there, it is now treatable and also curable. So do not lose hope, and I wish you all a very conscious Hepatitis Day, so all of you are aware of this particular day. Thank you.